The following program is rated G. It is suitable for all audiences.
First aid have three goals. 1. Preserve life. The overriding aim of all medical care, including first aid, is to save lives. 2. Prevent from further harm. Also sometimes called prevent the condition from worsening or danger of further injury. This covers both external factors, such as moving a patient away from any cause of harm, or applying first aid techniques to prevent worsening of the condition. 3. Promote recovery. First aid also involves trying to start the recovery process from the illness or injury, and in some cases might involve completing a treatment, such as in the case of applying a plaster to a small wound. Importance of first aid. The principles. First, do no harm and life over limb are essential parts of the practice of first aid. Knowing proper first aid procedures can save lives. It reduces the chance of infection, pain, bleeding, and scarring. It prevents danger of further injury. It meets the needs of unexpected occurrences in the community or simply within own household. It potentially saves lives with the use of minimal equipments. It is able to cater to minor injuries and illnesses without the hassle of going to the hospital or clinic. It provides emergency first aid management of injuries and illnesses until medical aid arrives. Guidelines of first aid. You can use the acronym EMCAP or MCAP. E. Environment. Check the environment if it is safe for yourself and the victim. M. Mechanism of injury. Observe the possible mechanism of injury, like a fall from a ladder, or from a dislocated shoulder, due to a motor vehicle accident. C. Casualty. Count how many casualties were injured. A. Additional resources. Call for additional resources such as a medical aid or even a bystander. P. Personal protective equipment. These are your gloves or your face masks. Try to remain calm at all times. Look around to make sure the area is safe. Make sure you are safe before providing care. Assess the situation. Try to find clues about what has happened. Estimate how many victims needs help. Call for additional help. Grab and apply personal protective equipment or don gloves, if it is available. Act quickly and communicate effectively while assessing the victim. Speak loudly to him or her. Tap the person and ask if he or she is alright. Introduce yourself and explain that you are a first aider, and that you are there to help. If the person is conscious and able to speak, ask the injured or ill person what happened. Listen to the injured or ill person. Let the victim know that you will be performing some first aid procedures to help him or her. Check the victim for injuries and look for these things: severe bleeding, changes in consciousness, irregular breathing, unusual color or feel to the skin, swollen places on the body, medical alert tags, anything the person says is painful. If the person is unconscious, you may need to start performing CPR. After the emergency, document the interventions performed. You may need an incident report. Try to remember as many details as you can. Report only the facts, not opinions. Remember, in an extreme emergency situation, never do anything that is beyond your ability or training. Stay within your scope of practice. Give basic first aid until the emergency medical aid arrives. Seizure is a result of abnormal electrical activity in the brain and causes temporary, involuntary changes in body movement, function, sensation, and awareness or behavior. There are many different types of seizures. Some have mild symptoms and no body shaking. Some have extreme, uncontrollable body movements. The person may have warning symptoms before the attack, such as fear or anxiety, nausea, vertigo, visual symptoms such as flashing bright lights, spots, or wavy lines before the eyes. First aid, intervention. Do not put anything in the person's mouth or between the teeth. People having seizures rarely bite their tongues or cheeks with enough force to cause significant bleeding. However, some blood may be present. Make sure that the environment is as safe as possible. Remove any nearby furniture or other objects that may injure the person. Give care to a person who has had a seizure the same way you would for an unconscious person. When the seizure is over, make sure that the person's airway is open. If there is fluid in the person's mouth, such as saliva, blood, or vomit, roll him or her on one side so that the fluid drains from the mouth. Check to see if he or she was injured during the seizure. If the seizure occurred in public, the person may be embarrassed and self-conscious. Ask bystanders not to crowd around the person. Stay on the scene with the person until he or she is fully conscious and aware of the surroundings. Call your healthcare provider if this is the first time the person has had a seizure. A seizure lasts more than 2 to 5 minutes. The person does not awaken or have normal behavior after a seizure. Another seizure starts soon after a seizure ends. The person had a seizure in water. The person is pregnant, injured, or has diabetes. The person does not have a medical ID bracelet. There is something different about the seizure compared to the person's usual seizures. Report all seizures to the person's healthcare provider. The doctor may need to adjust or change the person's medications. Epistaxis is the relatively common occurrence of hemorrhage from the nose, usually noticed when the blood drains out through the nostrils. First aid, intervention. Sit upright and lean forward. Pinch both nostrils shut for 5 to 10 minutes. If the bleeding doesn't stop, repeat these steps for up to a total of 15 minutes. After the bleeding has stopped, to keep it from starting again, don't pick or blow your nose, and don't bend down for several hours. Heat stroke is caused by prolonged exposure or doing physical activities in high temperatures, 104 degrees Fahrenheit 40 degrees Celsius or higher. When your body overheats, you first may develop heat cramps. If you don't cool down, you may progress to symptoms of heat exhaustion, such as heavy sweating, nausea, lightheadedness, and feeling faint. In a period of hours, untreated heat stroke can cause damage to your brain, heart, kidneys, and muscles. These injuries get worse the longer treatment is delayed, increasing your risk of serious complications or death. Heat stroke symptoms include high body temperature, a lack of sweating, nausea and vomiting, flushed skin, tachypnea, tachycardia, headache, unconsciousness, muscle cramps or weakness. First aid, intervention. When a heat-related illness is recognized in its early stages, it usually can be reversed. Get the person out of the heat. Move the person to a cooler environment with circulating air. Loosen or remove as much clothing as possible, and apply cool, wet cloths, such as towels or sheets. Remoisten the cloths periodically. Spraying the person with water and fanning can also help. Let the person rest in a comfortable position and watch carefully for changes in his or her condition. The person should not resume normal activities the same day. If the person's condition does not improve, has a change in consciousness, or vomits, bring patient to the hospital, as these are indications that the person's condition is getting worse. Watch for signals of breathing problems. Hypoglycemia is a condition that occurs when your blood sugar is below 70 mg per deciliter or 3.9 millimoles per liter. Hypoglycemia is commonly associated with the treatment of diabetes. However, various conditions can cause low blood sugar in people without diabetes. Like fever, hypoglycemia isn't a disease itself, it's an indicator of a health problem. During digestion, your body breaks down carbohydrates from foods into various sugar molecules. One of these sugar molecules is glucose, the main energy source for your body. Glucose is absorbed into your bloodstream, but it can't enter without the help of insulin, a hormone secreted by your pancreas. When the level of glucose in your blood rises, it signals the pancreas to release insulin. The insulin unlocks your cells so that glucose can enter and provide the fuel to function properly. Any extra glucose stored in your liver and muscles are called glycogen. This process lowers the level of glucose in your bloodstream and prevents it from reaching dangerously high levels. As your blood sugar level returns to normal, so does the secretion of insulin from your pancreas. Immediate treatment of hypoglycemia involves quick steps to get your blood sugar level back into a normal range, about 70 to 100 milligrams per deciliter, or 3.9 to 5.6 millimoles per liter, either with high sugar foods or medications. Long-term treatment requires identifying and treating the underlying cause of hypoglycemia. Your body needs a steady supply of sugar in order to function properly. If glucose levels become too low, as occurs with hypoglycemia, it can have these effects on your brain. Confusion. Abnormal behavior such as the inability to complete routine tasks. Visual disturbances, such as double vision and blurred vision. Seizures and loss of consciousness. Hypoglycemia may also cause these other signs and symptoms: heart palpitations, shakiness, anxiety, sweating, hunger, tingling sensation around the mouth. First aid intervention. Give sugar in the form of several glucose tablets, glucose paste, a 12-ounce serving of fruit juice, milk, non-diet soft drink, or table sugar dissolved in a glass of water. Give any kind of food with sugar on it. Diabetics also may carry glucagon, which they can self-administer, or you can assist to counter hypoglycemia. Sprain is an injury involving the stretching and tearing of a ligament or a joint capsule. Strain is an injury involving the stretching or tearing of a musculo-tendinous structure. First aid intervention. Use the mnemonics RICE. Rest. Do not move or straighten the injured area. Immobilize. Stabilize the injured area in the position it was found. Splint or bandage the injured part only if the person is not in pain and must be moved or transported to receive medical care. Compression. Fill a plastic bag with ice and water, or wrap ice with a damp cloth and apply ice to the injured area, for periods of about 20 minutes. Place a thin barrier between the ice and bare skin. If 20-minute icing cannot be tolerated, apply ice for periods of 10 minutes. If icing is still needed, remove the pack for 20 minutes, and then replace it. Cold reduces internal bleeding, pain and swelling. Elevate. Elevate the injured part only if it does not cause more pain. Poisoning is any substance, including medications, that is harmful to your body if too much is eaten, inhaled, injected, or absorbed through the skin. Poisons are substances that cause injury, illness, or death. These events are caused by a chemical activity in the cells. Poisons can be injected, inhaled, or swallowed. First aid is critical in saving the life of a poison victim. Some of the causes of poisoning are medications, drug overdose, occupational exposure, cleaning detergents or paints, carbon monoxide from the furnace, insecticides, certain cosmetics, certain household plants and animals, food poisoning, such as botulism. Some of the signs and symptoms of poisoning are blue lips, skin rashes, dyspnea, diarrhea, vomiting, nausea, fever, headache, drowsiness, abdominal and chest pain, palpitations, loss of appetite, numbness, muscle twitching, seizures, weakness, loss of consciousness. First aid intervention. Seek immediate medical help. Try and identify the poison if possible. Check for signs like dyspnea, vomiting, or burns around the mouth. Induce vomiting if poison is swallowed. In case of convulsions, protect the person from self-injury. If the patient vomits, take steps to prevent choking. If the vomit falls on the skin, wash it thoroughly. Place the victim in recovery position as you wait for the emergency medical help to arrive. Prevention tips to avoid poisoning accidents. Store medicines, cleaning detergents, mosquito repellents and paints carefully. Keep all potentially poisonous substances out of children's reach. Label the poisons in your house. Avoid keeping poisonous plants in or around the house. Be aware of eating products such as berries, roots, or mushrooms. Teach children the need to exercise caution. Hypotension occurs when blood pressure during and after each heartbeat is much lower than usual. This means the heart, brain and other body parts do not get enough blood. The causes of low blood pressure can signal an underlying problem, especially when it drops suddenly or is accompanied by signs and symptoms such as dizziness or lightheadedness, syncope, lack of concentration, blurred vision, nausea, cold, clammy, pale skin, rapid, shallow breathing, fatigue, depression, thirst. First aid intervention. Lie down slowly to reduce the pressure of gravity. Position your feet higher than the heart so that the blood will flow to the upper body. Massage gently from the foot to the calf, thigh, stomach, and so on, so that the blood will flow towards the head. Patients with hypotension is recommended to add salt intake, including salty foods. Daily salt intake for patients with hypotension is 10 to 20 grams, or 1 to 2 tablespoons flat. Motor vehicle accident occurs when a vehicle collides with another vehicle. Pedestrian, animal, road debris, or other stationary obstruction, such as a tree or a utility pole. When evaluating the scene of a motor vehicle accident, inspect the windshield for blood, hair, or deformity. If the victim was involved in an accident while wearing a helmet, inspect the helmet for scratches, dents, or breaks, as well as for the presence of blood or brain matter. It is important to note and report to the medical team the extent of damage, as well as the type of helmet worn. Evaluating the types of helmets such as a full face, 3/4 shell, and a half shell may help in determining the extent of possible injuries to both the face and head. In a motor vehicle accident, the first aider must use every effort to limit movements of the spine while performing treatment so that the risk of injury to the victim is reduced as much as possible. All victims with suspected spinal injuries should be treated for life-threatening injuries first, before managing the spinal injury. After managing the life-threatening injuries, make a quick survey to reveal any contusions, deformities, lacerations, punctures, penetrations, or swelling. First aid intervention. Instruct a bystander to get behind the victim and hold the cervical spine into a neutral, in-line stabilization, while the first aider checks the circulation, breathing, and airway. Check for response. Talk to the victim and tap them gently. If there's no response, you may need to start performing CPR. If the victim is conscious and able to speak, let him or her know that you are a first aider and that you are there to help. Communicate to the victim to assess his or her level of awareness. As you continue to communicate with the victim, start your treatment by measuring up an appropriately sized cervical collar to immobilize the cervical spine. One of the first aiders will apply the cervical collar for more security of the cervical spine. Another first aider will assess the pulse, movement, and sensation of the upper and lower extremities. Working along the long axis of the victim, the bystander continues to hold and stabilize the head, while the first aider supports the upper body trunk by placing one hand on the shoulder of the victim and the other hand grabbing the hip. The other first aider will prepare to slide the longboard underneath the victim by placing the longboard as near the victim as possible, with the bystander and the first aider collaborating their movements to limit the rotation of the spine. The victim is maneuvered onto the longboard by the method of log rolling him or her in a short, steady, and quick controlled movement. Secure the victim on the longboard by strapping him or her. Ensure that the straps are not too tight for good circulation. Reassess the pulse, movement, and sensation of the upper and lower extremities. Care for other non-life-threatening injuries such as a joint dislocation or fractures. Signs and symptoms associated with bone and joint injuries may include deformity, pain and tenderness, swelling and bruising, exposed bone ends, joint instability or locked into position, splint fractures prior to transport to control pain and prevent further injury. When in doubt about the existence of a fracture, a painful extremity injury should be splinted, even if none of the above signs and symptoms are present. The presence of pain is indicative of injury, and splinting may serve to decrease the patient's discomfort. For the critical patient, splinting should be accomplished, as time allows, once transport has been initiated. Before splinting, remove clothing, or cut it away, and assess the extremity for pulse, movement, and sensation, distal to the injury site. The proximal and distal joint should be immobilized for a suspected bone injury, and the proximal and distal bone should be immobilized for a suspected joint injury. Following splinting, reassess pulse, movement, and sensation, then record both assessments. Wait for the medical team for rapid transport. Wound is a type of injury in which skin is torn, cut, or punctured, open wound, or where blunt force trauma causes a contusion, closed wound. The four main types of wounds are: abrasions, happens when the superficial area of the skin is scraped. Lacerations, occurs when a blunt force splits the skin. Avulsions, happens when a portion of the skin is partially or completely torn away. Punctures, occurs when a pointed object pierces the skin. First aid intervention, call immediately for emergency medical help. Control bleeding by covering the wound with a dressing and firmly pressing against the wound until bleeding stops. Apply a pressure bandage over the dressing to maintain pressure on the wound and to hold the dressing in place. If blood soaks through the bandage, do not remove the blood-soaked bandages. Instead, add more dressings and bandages, and apply additional direct pressure. Observe the person closely for signals that may indicate that the person's condition is worsening. Care for shock. Keep the person from getting chilled or overheated. Have the person rest comfortably. Bandaging is applied to create pressure over an area, to immobilize a part of the body and restrict its motion, to support and protect wound from contamination, to reduce bleeding or prevent edema, to secure a splint or dressing. Scalp injury. Forehead injury. Ear, cheek, jaw injury. Shoulder injury. Chest injury. Arm, elbow injury. Wrist injury. Hand horizontal injury. Hand vertical injury. Ankle injury. Transfer and ambulation. Types of carry. One-man carry. Assist to walk. Piggyback carry. Carry in arms. Pack strap carry. Fireman's carry. Two-man carry. Assist to walk. Two-hand seat carry. Four-hand seat carry. Carry by extremities. Four-man carry.
I'm sexy and I know it. I'm sexy and I know it.
Oh wait, wala na record yan.
Wait, may postes of ma! Yay! Hindi mo part ha? Hindi yung telepono!
Injured ba? Injured? Tawag mo per 2, 3, go! Ay! 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 Ikat na kay mabot naman ang rescue. Ay sa, o pagani! Ayun! Ikat Enough na kayo. We'll not gonna do bleeding here. Okay, kuhaan. Gasgas mo na siya yun. Reaction. Galing! Ayaw niya pa-open! Gusto na niya kakayang mag-isa.
Hug me! Hug me! Hug me! Hug me!